You've seen those ultra-short videos on social media explaining IVF in 60 seconds. But let's face it, this life-changing process deserves more time, more care, more understanding. That's why we're dedicating today's video to IVF, breaking it down step by step. You can better understand this complex process that brings dreams of parenthood to millions. Let's dive right in. First things first, what exactly is IVF? IVF stands for in vitro fertilization. In simple terms, it means fertilizing an egg with sperm in a lab setting outside the body in a controlled environment. Once the fertilization occurs, the resulting embryos are allowed to grow in a lab for several days before one or more are transferred into the uterus, with the goal of establishing a pregnancy. Section 1, Step 1, Ovarian Stimulation. The IVF process kicks off with ovarian stimulation. During this phase, the ovaries are prompted to produce multiple mature eggs instead of just one, which typically happens during a normal menstrual cycle. Why multiple eggs? Well, the chances of fertilization are higher when more eggs are available. Think of it as increasing your odds of success. To achieve this, women are given hormone injections daily for about 8 to 14 days. These hormones, known as gonadotropins, work together to stimulate the ovaries. They are usually a mix of follicle-stimulating hormone, FSH, and luteinizing hormone, LH. The ovaries respond by producing multiple follicles, small fluid-filled sacs that each contain an immature egg. As these follicles grow, so do the eggs within them. The entire process is carefully monitored through regular ultrasound scans and blood tests. This monitoring allows the medical team to keep an eye on the development of the follicles and the quality of the eggs. It also helps them determine the best time for the next stage of the IVF process, the egg retrieval. Section 2, Step 2, Egg retrieval. When the eggs are mature, it's time for retrieval. This procedure is performed in a hospital or clinic setting and takes approximately 20 minutes. The woman is under light anesthesia, so she's comfortably asleep and feels no pain. The retrieval itself involves a minor surgical procedure where a small needle is inserted through the skin of the lower abdomen to gently suck out the fluids containing the eggs from the grown follicles. No, it's not painful because of the anesthesia. Yes, you might feel some pressure or bloating sensations, but nothing more than that. Once retrieved, the eggs are immediately sent to the laboratory where embryologists get to work preparing them for fertilization. Section 3, Step 3, Fertilization. In the lab, the eggs are combined with the man's sperm in a specialized Petri dish. The goal is to facilitate fertilization. Now there are a couple of ways this can happen. The most common method is called the conventional IVF approach. Here's how it goes. Sperm is placed in a dish with the eggs. And then naturally, the sperm and egg meet up and fertilization occurs. The second approach is known as ICSI, which stands for intracytoplasmic sperm injection. ICSI is particularly useful when there are concerns about the health or motility of the sperm. During ICSI, a single sperm is literally injected into the egg. It's like a tiny, precise operation. But don't worry, it's done with a very fine needle and only a few cells are involved. Both methods are effective in their own right. Ultimately, the choice between them depends on the specific circumstances of the couple and their fertility journey. After fertilization, the resulting embryo is left to grow and develop in the lab. It's a crucial step where nature takes its course and hopefully results in healthy embryos ready for the next stage. Section 4, Embryo Culture. Over the next 3 to 5 days, embryologists meticulously observe and monitor the embryos as they grow and divide. Not all embryos will develop successfully. Those that do will go through various stages, 2 cells, 4 cells, and so on. It's a delicate process, and the embryos are incredibly tiny, so it requires patience and precision. Around day 3 or day 5, the embryos reach a stage called the blastocyst stage. At this point, they consist of hundreds of cells and are ready for embryo biopsy, something that only happens in certain situations and requires the expertise of genetic specialists. If a biopsy is performed, it's done at this stage. Otherwise, the embryos continue to develop. Out of the fertilized eggs, only a few will become blastocysts and even fewer will be of good quality. That's why choosing the healthiest embryos for transfer is essential. Often not all embryos will freeze well, so if there are extra, they might be kept for a future attempt. However, if there are none left after the first round of IVF, the couple might need to consider other options like egg donation or surrogacy. Section 5. Embryo transfer. Once the best embryos have been selected, it's time for the embryo transfer. This is often considered the most emotional step of the entire IVF journey. The embryo transfer procedure takes place in a sterile room, usually in the same clinic or hospital where the IVF process began. It's performed by a skilled reproductive specialist using a thin catheter. The procedure begins with the woman lying on a table with an ultrasound probe and a speculum inserted. The specialist uses ultrasound guidance to precisely locate the uterus, and the catheter is gently inserted through the cervix into the uterine cavity. Then one or more carefully selected embryos are deposited into the uterus, and that's it. The whole process takes less than 10 minutes, and the patient doesn't need any anesthesia. Right after the transfer, the woman can get up and go about her day. Although there might be some mild cramping or spotting, both are perfectly normal and should subside within a few days. After the embryo transfer, patients are often advised to rest for a few minutes in the clinic to relax before going home. It's a moment filled with anticipation and hope as the couple waits for the next big step in their journey. Section 6. The 2-week wait. After the embryo transfer, there's a mandatory 2-week wait before the next steps can be taken. This is perhaps the most challenging part of the IVF process. During this time, the embryos are in the uterus and hopefully implanting into the uterine lining. It's a critical moment where the future of the pregnancy hangs in balance. Patients will often schedule a blood test for about 10 to 14 days after the embryo transfer. This is to measure the levels of HCG, a hormone produced by the developing embryo if implantation has occurred. Until that blood test, the couple is left to navigate a mix of emotions, hope, anxiety, excitement, and sometimes fear. The wait for the test results can feel endless. Each day might seem to stretch on forever, marked by heightened awareness of every little twinge or symptom. It's a mixture of physical and emotional tension unlike any other. Section 7. Success rates and challenges. IVF success rates depend on several factors, including the woman's age, overall health, cause of infertility, and the quality of the embryos. On average, the chances of success range from 30 to 50% per cycle. However, many couples might need multiple attempts to achieve pregnancy through IVF. It's not uncommon for the process to take several cycles, and each attempt comes with its own set of expenses, physical and emotional toll. So why do so many people go through it? Because for many, IVF offers the only viable path to parenthood. It's a journey filled with ups and downs, successes and setbacks. But for those who persevere, the ultimate reward, holding their child, makes it all worthwhile. In a nutshell, IVF is a journey of hope, patience, and love. It's a testament to the incredible advancements in science and medicine. And it's a beacon of hope for couples facing infertility. Whether you're considering IVF yourself or just learning about it, remember you're not alone. There's a community of individuals and professionals ready to support you every step of the way. IVF is not just science. It's a dream of holding your own child, sharing unconditional love, and experiencing the joy of family.